Now we're going to hear from three different perspectives on chemosensory testing in clinical practice. And the first is Katie Boateng, who we saw and heard about from last night in the STANA. She is the president and co-founder of STANA, and she's been very involved in advocacy and helping patients with smell costs. She has a smell podcast and has really led the effort. So look forward to hearing Katie's perspective.
Hi everyone, can you hear me? Hi, I'm so excited to be here and speak with you all today. As stated, my name is Katie Boateng. I'm president and founding co-member of STANA. We're the Smell and Taste Association of North America. So today I'd like to talk a little bit about the following topics. I know most of you in here already understand what chemosensory testing is, but just to make sure that our patient audience does as well, I'll be defining that briefly. I'm going to talk a little bit about my own story with smell dysfunction, talk some about who's affected with smell and taste dysfunction, and then I'd like to dive into the patient's perspective on this, why we need universal chemosensory testing, and STANA's call to action. So chemosensory testing is basically a fancy way to say that we're assessing someone's ability to perceive and identify different smells and tastes. So I just wanted to put that out there to make sure that everyone is on the same page with what we're talking about today. I've included some of the common tools that are already used up here, but there's many more, especially some we're talked about today that I didn't even know about, so that's great. So to share a little bit about my own story, I became an acquired anosmic during my first year of college. So I lived in a shared apartment with 5 other ladies, which was a great experience, and it was the first winter of college. I got really sick. I had an upper respiratory infection, and it was really lingering for weeks and weeks. I think probably 5 total. So during winter break, I didn't feel well, and then I came back, and it was sometime in the spring. I don't remember the exact time frame, but I was sitting at breakfast one morning, eating my cereal, and one of my roommates started spraying cleaning spray, bleach spray all over the table. And I thought to myself, hey, why are you doing that right now? I'm eating my breakfast. And then my second thought was, wait a second, I actually don't smell that. So I started going around our shared apartment, smelling the trash can, opening Tupperware containers in the fridge, trying to get something out of them, and I realized I'm not sick anymore, but I can't smell. And so what happened for me next was that I started my medical journey. So I went to my primary care provider first, and this is over a decade ago now, so I don't remember if I went during spring break or if I waited until summer break, but my primary care doctor was actually about 2 hours away in my hometown. So I went there first and I presented to the doctor. I said, hey, I have no sense of smell. Do you have any idea what might be going on? And the feedback for me was, well, maybe you have allergies or maybe you have some inflammation going on, so let's give you some nasal steroids. So I started taking nasal steroids for quite a while. I'd say 3, 4, 5 months. I went back to my primary care provider on another break or on another time that I was able to get back home, and I still had no sense of smell. So at that point, I was referred to an ENT. So I went to the ENT, the ear, nose, and throat doctor, and they did tests on me to figure out what was going on with my sense of smell. So I had like the scope up my nose, double checking I didn't have any nasal polyps, anything like that. And they ruled out anything that they could visually see that was causing me to have no sense of smell. I don't remember if I was given the CT and the MRI right away or if I came back for another visit for those, but I did have that testing too. After a couple more months of taking nasal steroids, which was the recommendation from the ENT as well, I came back again, so we're probably 6 to 9 months into this now, and I said, hey, I still don't have a sense of smell. Any ideas? And at that point, I was referred to a neurologist. So I went to see a neurologist, and they ruled out any brain-related issues that they could see or tell, like a brain tumor, which was great news. I didn't have a brain tumor, and said, we don't know why you can't smell. No need to schedule a follow-up appointment. That was it. So not even like good luck or have a great life, just feel free to pay your copay and you can go. So at that time, I kind of ignored not having a sense of smell for a while because I didn't know what to do with it. I put it into a little emotional box and tied it up with a bow and stuck it in like my emotional bookshelf closet because I didn't want to think about it or talk about it. And so I avoided it for quite a while. Until actually 2018, I attended the ITTSD conference here at Monell in the same building and got to meet some other people. During that same year, I actually started producing the Smell podcast. And the goal of that is to share patient stories, scientific research, and news about the world of smell. And the reason I started this podcast is because I needed a resource when I first became a nosmic, and it didn't exist. So I thought, why not me? I'll make the resource. So I've been doing that since then, and it's been an amazing experience. In 2020, I got connected with the people that I had met from the first ITTSD conference, and we actually started the Smell and Taste Association of North America, or STANA for short, and I'm president and one of the founding members, as I said. I joined the GCCR Patient Advocacy Committee, and GCCR is the Global Consortium for Chemosensory Research. And I'm also connected with Fifth Sense as an ambassador, so shout out to Duncan Boak and Fifth Sense, they're here. The last thing I want to share about my story before I move on to patient demographics is that in 2021, I actually gave birth to my son. And while we were at the hospital, he was born at about 5 p.m. on a Friday. And before noon on Saturday, someone rolled into our room with a cart and said, "I'm here to do your son's newborn screening test." And they hooked him up to electrodes and checked his hearing. And I thought, wow. That is amazing. I wish that we had something like that for smell. Another thing that is an inspiration for my son is vision screening. So the other day, I picked him up from daycare, and they had on the counter a little pamphlet, a little flyer that said, "Parents, sign up for our vision screening. It starts at age 4." And again, I thought to myself, wow, they're even coming to the daycare to do vision screening for children. That's amazing. Why don't we have that for smell or taste? So that's what I wanted to share about my own story. So we've heard a little bit about who's affected already, but I want to talk about patient demographics. You can see up here, this information comes from a survey from the NHANES, or the National Health and Nutrition Examination Survey, from 2011-2012. I should get points for remembering what that meant. You can see that 12.4%, or almost 1 in 8 Americans over the age of 40, so approximately 13 million people, have measurable smell dysfunction. And in regards to taste, it's about 5%, or 1 in 20 Americans who are having some kind of distorted taste. And what I'd like to point out here is that we really lack an accurate count of people who are affected by smell and taste disorders. This information is over a decade old, and think about how these numbers have changed in light of COVID-19. And while many Americans are affected, research is underfunded relative to other senses. So the budget for federally funded smell and taste related research is only a fraction of that for the other senses under the NIH's NIDCD. So with STANA, we get to connect with patients, and I want to talk about how it affects our quality of life. So up here on the screen, we have some quotes, and they're a little bit small, so I'll read them to you. But these are quotes that we collected from people in honor of Anosmia Awareness Day, which is February of each year. So the first one here says, "For me, life has changed. Every meal is a challenge. Fighting against this condition is not easy, but it's possible. Missing the smell of food is the hardest part. It takes a lot away from the enjoyment of both cooking and eating. I find living without smell very depressing, and it has affected my whole life in every way. After a traumatic brain injury, or TBI, I lost my sense of smell and a lot of my taste. While I'm fortunate to be otherwise healthy, the thing I miss most is the way certain smells used to trigger happy memories for me. Anyone that has experienced taste and smell loss can understand it affects everyday living. Hopefully, it can be fixed someday." So we found out by participating in a USA Smell and Taste Patient Survey, STANA, along with Jefferson Health and the Monell Center in 2022, that patients want to be engaged and they want to be a part of the solution. So this survey we prepared was to understand the effects that patients are experiencing on their quality of life from COVID-19 and other causes of smell loss. We conducted this in April of 2022 online, and we had over 5,500 validated responses within a 2-week time period. So it was only online for 2 weeks. And I'd like to say that I predicted in advance that we would have over 5,000 respondents, and I was correct. So I felt really happy about that. So one of the questions that we asked them was about their quality of life. So smell and taste plays a crucial role in our daily lives, as we've been saying. It influences our food preferences, our safety, and our overall quality of life. So this question was asking them to rate what areas of their life had been affected by their smell or taste dysfunction. So we tried to group them by color, but the ones in green have to do with like cooking and eating, food choices, and nutrition. So you can see that 66% of those who responded to this question said that their cooking had been affected by their smell or taste dysfunction, and so on and so forth. So I think this is really powerful to take a look at all of the different areas of someone's life that are affected by living with this disorder. Right here, we asked them about their chemosensory testing. When they went to the doctor, what kind of testing did you receive? And most patients indicated that they did not receive any type of testing at all, about 34%. The second most common answer was smell testing. And I mentioned my own healthcare journey before, and the one thing that I wanted to point out about that is that no point during any of that, of those months that I was going to the doctor, was my sense of smell ever actually tested. So I never took an objective smell test. They just believed me that I couldn't smell, but I didn't take a test, which was interesting. So smell and taste disorders are definitely an underappreciated public health concern currently, and they're not regularly diagnosed or tracked because we don't have regular smell testing. We lag behind in taste and smell research with very few clinical trials for this area. And one of the reasons that we need universal chemosensory testing is because it's important, but also the NIDCD's 2023-2027 strategic plan has a stated aspiration that medical providers will routinely use these smell tests to help identify people who are more likely to develop disorders where smell loss is a symptom, like Parkinson's disease or Alzheimer's. Another reason that universal chemosensory testing is useful is as an early detection of disorders or as a diagnostic tool. So changes in your taste and smell can be early indicators, like I mentioned, of certain medical conditions like Parkinson's disease and Alzheimer's. Early detection and diagnosis can save money for everyone, which is always a good thing for patients and for the healthcare system. It can also help monitor treatment effects. So we speak with patients who are undergoing chemotherapy or radiation treatment due to head and neck cancer, and they have a lot of issues with their smell and taste and overall, therefore, their quality of life, in particular, their nutrition and not wanting to eat or not being able to eat. So if we monitor the treatment effects on their smell and taste, this can help clinicians adjust treatment plans and manage their side effects. And maybe they have to take that medication, but then it could help these clinicians say, we understand that you're not able to eat or that you're not wanting to eat because your smell and taste are affected. Let's make a plan for that. Let's connect you with resources, dietitians, nutritionists, those types of things. Something really important for why we need universal chemosensory testing is patient validation. So you guys, if you were on last night, probably heard a lot about this, but chemosensory testing can validate someone's lived experience by providing evidence that there's a problem. Dia Klein last night spoke about how she actually has her diagnosis framed on her wall because that is how validating it is for her. I spoke a little about how that would be useful for me every time I go to a new doctor's office, that I don't have to explain or express what anosmia is to my care provider. Chemosensory testing is useful for nutritional assessment because, again, changes in taste and smell can affect your dietary habits and your nutrition. For me, if I could get away with it, I would eat chips, crunchy things every day, all day, because those things resonate with me more now. I don't personally have flavor perception, so I gravitate towards things that are salty, high fat. McDonald's is great as an example, but it's not healthy for me to be eating that every single day. So that is why it's important to be aware of these. This can aid in nutritional assessments, especially for nutritionists and dietitians, so that people can have a plan. We understand your smell and taste is affected. We understand you're going to gravitate towards salt, towards sugar. Let's make a plan for that. So the Every Life Foundation for Rare Diseases recently did a health economic study called The Cost of Delayed Diagnosis in Rare Disease, and lack of testing and a delayed diagnosis can worsen patient outcomes. Commonly now, when people present with smell dysfunction, they are recommended to try smell training because that's one of the most commonly used treatment options. And if we delay their diagnosis, it could be too late for something like that to recommend smell training. For me, who has been anosmic now for over 14 years, it wouldn't make sense to recommend smell training to me. This can also financially affect patients. So a delayed diagnosis. Testing can provide a more definitive course of care. It can help avoid unnecessary doctor visits or medical interventions. And a lot of these treatments require out-of-pocket funds from the patient because they're not covered by insurance. Or perhaps the person doesn't have insurance. There's also a lot of safety considerations. So impaired taste and smell affects the person's ability to detect danger in their home, including the things that are listed here. One that I'd like to talk about, I have a recent example, is fire or smoke. So our home system, we have a security system that includes a fire alarm system, which I didn't realize that was included in this security system. So at 3 a.m. in September, our alarm goes off and it's the fire alarm ringing all over the house. The company calls and they're talking to me on the phone and they said, "We have an alarm for a fire. Do you have a fire in your home?" And I said, "I don't think so." And we were running around the house looking around. Is there a fire somewhere? Is there a fire in the garage? Is there perhaps one in the attic? And the lady on the phone says, "Well, do you smell smoke?" And I said, "Well, I can't smell smoke. Let me ask my husband." But my husband travels frequently, so I'm grateful that he was home at that time. But what would I have done if he wasn't there? Because that would have really caused me a lot of anxiety to not know if there was actually a fire in the attic or a fire somewhere not easily visible that I can't see. And I know for sure that I would not have been able to go back to bed. So another reason that it's important that we have universal chemosensory testing is for research and treatment development. Currently, there are not a lot of effective treatments for these disorders. And if we have that information, if we're collecting data from people and we're understanding who is affected by smell and taste disorders, this can help lead to new treatments for smell and taste dysfunction. So our calls to action from STANA are to support our change.org petition for universal testing. You can take a screenshot of this QR code if you are interested. The petition is through change.org, and it is advocating to make smell and taste testing as routine as vision and hearing exams. We'll also go ahead in a minute, if it's not already there, and post the link to the petition in the lobby chat so you can take a look at it and sign it if you are so inclined. We'd also love if you could support STANA. We are a small nonprofit, so if you're interested, you can make a donation or join our mailing list so that we can continue to provide resources for people who are affected by smell and taste dysfunction. Thank you.
Wonderful. Thank you so much. Now we're going to hear from the primary care perspective and Dr. Pauline Joseph from the NIH. And very long biography here, but she's the chief of the section of sensory science and metabolism, and she is developed the Sensimet lab, which I hope we're going to hear more about, and has done a lot of research. So, Dr. Joseph.